Hi everyone. Feel free to continue enjoying your lunch. Bill and I want to do this in a more informal way. I know we have a PowerPoint and all that, but that's just to guide us. So we're going to talk about the project and where it came from and so on. I'm going to be doing the actual presentation of the PowerPoint and the facts. Bill is going to be jumping back and forth in whenever he has something to say or a question to ask. Feel free. I'm not asking you to save your questions. Put up your hand to say comments. We can do this more as an exchange and a discussion as well. So it's just that we need to cover our material, so I might have to cut you off after a bit, but feel free to put up your hand and jump in anytime you have something to say. Posez les questions en français, on peut répondre dans les deux langues, c'est pas un problème. Okay, so let's start. Oh, good, it's working. So how this innovative practice project started. It actually started 3 years ago, in fact, in January of 2012. Right, 12, 13, yeah, 3 years ago. And it started where Bill and I got an innovative practice grant from CREGÉS to develop a project around the questions. Now, what it is, some of you, or maybe most of you already know that I have been running the caregiver support groups here at the CIUSSS for forever. And Bill, of course, as you well know, is a social worker in SAPA. It started with myself actually asking some questions because I had noticed, there's a chair up here, I had noticed there was an increase in the number of participants in my caregiver support group, especially the one that runs every week. And the weekly one is for spouses. And the men who were coming were all, of course, older males because it's our services. So one day, informally almost, I got into a talk with Bill about, gee, I've been getting a lot more men in the group. In fact, 3 or 4 men is a lot for a caregiver support group because the model is very focused on women. And Bill said, well, yeah, kind of. I sort of am seeing a few more older male caregivers in my practice as well. So we started talking about it. We got together with a researcher here who is no longer here. He's retired, Jean-Pierre Lavoie, who brought in as well another researcher from CREGÉS, Isabelle Van Pavenage. We all sat down and we hammered out a project. So that's how we started creating our team. Over time, over that 3 years, we actually ended up with a fabulous team that included the regroupement d'organismes montérégiens, soutien aux légendes naturelles. I can't remember. It's Roma. It's called Roma. It's situated in Brossard. They joined the team. The Centre Entre Aidants in Saint-Hubert joined the team by sending a worker. And the RANC, Regroupement des Aidants Naturels de Québec, joined the team in the form of Jacques Couture, who actually had written a whole memoir on l'aide au masculin for caregivers. So we really had a fabulous team, which ended up being 3 men and 3 women. So it was quite well balanced. We had researchers practice, and it sort of ended up being a fabulous team that worked on this project. So that's how we did it. We developed the process through time. It ended up taking 3 years instead of 1 because we just kept adding components and going on different roads. But what's nice is CREGÉS Innovative Practice is kind of flexible. So every year you had to justify an extension. So we did, and we ended up with this. So that's so far. We're going to get into the project because we only have, like I said, an hour. So we started asking a few questions, just making sure. Oh, I went the wrong way. Okay, we asked a few questions. This is the questions we started formulating ourselves as a team. As practitioners to older adults in home care, do we treat male caregivers in a different way? Simple question. How do male caregivers, and we include sons and husbands because we realized there was 2 groups of older male caregivers. There were the adult sons caring for their aging parents and the spousal. And there was actually, we were able to, after a while, differentiate between even those 2 age groups of males. And how do male caregivers manage their stress? All of this to say is always in generalizations because it's basically manage their stress compared to how do females manage their stress. Although we didn't want to make it as black and white as this is how women do it and this is how men do it, but it's just that was our basic point of comparison. So we asked ourselves, why does this subject matter? Our research assistant that was hired, we actually had 2 or 3 over that whole process, found documentation. So as you all know, there's an increase in the number of male caregivers because there's more women diagnosed with dementia, and more often than not, that's the caregiving role. It's to care for somebody with dementia. There's an increase in the number of older people. That's just longevity. You know, the population aging is rising, including baby boomers. So we presume by the need is rising because the numbers of older people is also rising. And smaller families, and that was an interesting point. Smaller families means smaller children, number of children, and so that meant fewer females, fewer daughters. So often not, if there was a family of only boys, the male in the family had to start taking on the role of caregiving. Bigger families inevitably often produced females, and usually the caregiving role fell onto the girls. So these were just generalization that helped us move forward. Actually, research says from our own Santé Publique, only 20 to 30% of older clients getting help from the CIUSSS are male. And when I say that, CIUSSS, it's not just ours, all the CIUSSS services. The men who need help don't ask for it. They don't recognize they need help, and we'll explain why in a bit. And they don't know where to go to get it when they do need it. And that came out very strongly in a lot of the research that we did. So what did we learn? Well, one thing we learned is that the caregiving world is quite different for older men and older women. And we'll explain. Older male caregivers actually perceive their role in a different way than females, even though the tasks end up being the same, but their perception is different. And they express their needs differently. And they have their own ways of managing their stress, which is important. We'll explain why, to be able to recognize how their stress management tactics are not the same as females. The third major point is that home care and community practitioners react to older male caregivers in a different way. And that came out through studies and through interviews that were done particularly by our colleague Jacques Couture, who wrote this, asking practitioners in the community, how do you perceive how men are doing in their role?
And that's what led to the title of the project too, The Hero Effect.
Do you want to explain the title?
Well, you may just find that even in the work that you do, sometimes we just look at men differently. We maybe applaud their efforts a little bit more. We're more impressed when they do a good job of it. I've seen cases on the team where we've had men as caregivers, where people really seem to really see these men as heroes, quite differently. And I think for me, I was interested in that bias too, how we see female caregivers versus male.
Yeah.
So when approached by Norma and Zelda, that was interesting for me. I'm always interested in examining the biases that I hold towards our clients. I remember one gentleman in particular who was caring for adult children with a déficience physique, and his wife, and every person that came in spoke about that gentleman. It was like clockwork. Everybody that went in came back and says, how does he do it? How does he do this? And I was involved as well, and it was interesting to see that kind of a response from the team. So for me, that was part of what sparked my interest. And
you have to ask yourself, would you be all talking about it if it was a female? Mm-hmm. Maybe, but not necessarily. What a guy, right? Mm-hmm. With one of the trainings we've been offering, we've actually offered it now twice in the community because our partner in Brossard actually pushed that forward a lot. One of the practitioners that was there said himself, he said, when I see an older guy doing that job, I think, what a hero. And, that's where our title came from. Like, is there a hero effect? Are you subconsciously reacting to the fact that it's an older guy and he's doing all this stuff? Yeah. Anyway, to continue. So the different caregiving experience for older men. We're talking here about socialization. And we all know little girls are socialized right from the beginning, and it's just automatic. The caring role, is it coming more automatically to the women because they've been sort of the carers of the family, of their group all their lives? So do we say that they're better equipped to be caregivers? Possibly. So men are not necessarily socialized as nurturers, and caregiving is seen as women's work. And for that, I'd like to just talk to you just show you. I'm not going to talk a lot about it. There's something I'm going to say a bit later. The article calling Taking Women's Work Like a Man, Husband's Experience of Care Work, actually ended up being a really important article for us that guided us in this project. So men often not, and like I said, I'm talking in generalizations, they feel that asking for help is a sign of weakness. They wait until there's extreme need. They wait longer than women to ask for help. They're not comfortable about talking about their feelings, and we kind of know that already. And they often do not have an extensive support network aside from their immediate family, because more often than not, the wife has been the one that's guided their socialization, and she's got the network that's been built up. He doesn't necessarily have direct contact with it like she did. She was the social organizer for their family. So they might not have that as easily as a woman. And they often do not have a lot of experience accessing health and social services. The same way they probably weren't the contact person for the schools as their children grew up. They also were probably not able to know how to work the system as well as maybe a woman would. And they receive more positive comments from others about their role, which isn't a bad thing, but in fact they do get more positive reinforcement, let's say, from women. So how do they perceive their role as caregivers? The men reported, do I have the right screen? Tell me if I don't have the right screen that I'm referring to. They see their role as payback, which is interesting, I thought, because most of them say, she's taken care of me for so long. Now I need to do for her. And the same for the adult sons reported the same thing. They saw it more as payback, as something they were doing outside of their norm. They also stated that they felt that it was going from the productive, visible world of workforce to the invisible world of domestic tasks. And that is a really important point, because that reflects directly on, they see their role as caregiver as a job, more so than some of the females who say, that's just natural, that's what I do, that's what I've always been doing, I've been caring for the family. But for them, they actually see it as a job, and that has a learning curve. Many of them stated that they felt outside help is a waste of time, it's useless. So because of that, they are quicker to give up. If once they decide to ask for help, they abandon it faster if it doesn't materialize when they want it. They want it, and they want it now, because I've finally given in and admitted I need help. So what's the matter with you people? Why aren't you giving it to me when I want it? And we all know that's not possible. Our system isn't constructed. We don't differentiate. So that's important. But it's important to keep in the back of your head, their expectations are of immediate satisfaction for their needs, because they've waited so long to ask for help, longer than the females. What kind of support do they want? They want skills. They're task-oriented, because often in their jobs they were task-oriented. So give me skills. They want information about this illness and symptom management. And since many of them are caring for spouses or mothers or fathers with dementia, that's a big learning. So if we have pamphlets we could give them about the illnesses, that's important for them. They want to be able to manage difficult situations. Not to say females don't, but for them, this is again going back to their task needs. And they definitely want to be considered as a partner in care decisions. They don't want to be told, they want to be consulted. And they want domestic help. This is all besides the fact that they all want respite. Everybody wants respite, but they would like to have more help with domestic tasks, which isn't, again, maybe if we knew more ways to access organizations that could help with domestic help. Anybody have any comments? Does this strike you as making sense, what you're hearing so far? I see, because I'm seeing nods. I'm seeing nods from all of you. Yeah, comments, and feel free, like I said. Okay. Formal support services. So here, formal support services are us. It's just our services. So they're actually used less often than compared to females. They're asking for help or getting help is a sign of weakness, and it's linked to their identity. They stated that clearly in many of the studies we read. They really find accessing services difficult, and the call waiting on call waiting and transfer and call this number and all that. Now, this is where I think it would be a good time to say the difference between the older male caregivers, which I would say they're caring for their spouse. So let's say they're in their 75 years of age and up, and the younger male caregivers who are caring for their parents. There was a difference in that between these two age groups. The younger male caregivers are more find these services more accessible, or they're able to access them more easily. That could be just a generational difference, because maybe they've been more tuned in. They're saying now that probably the next generation will find it a little easier too, because the men are more involved. But right now, not to sound, we don't want to sound biased or all, but the older male caregivers, 75 or up, are the ones who do find it the most difficult. They also said that having a positive first experience, that would be the first meeting you have, and of course the client is the care receiver for you, so the caregiver is there usually, and that first experience is, if it's a positive first experience, they're more likely to go on. If it's a poor, negative first experience, they'll quit sooner. The sources of stress, yes?
I'm just curious, did you have any information about what constitutes a positive experience for them?
Getting what they want.
Got it.
I think getting what they want,
or at least having the hope of getting what they want.
And I think usually I find that the men will get their emotional support needs met through the service of concrete help. And I think that women who are caregivers will frequently, they may just call you and say, I'm having a terrible day, I need to talk, I need to see you. Men almost will never do that. But if you have to go by to drop something off or visit for some reason, some vehicle, they will often bring up what's going on. I remember when I was working in a day program, we had a lot of men who were in their late 70s and 80s, and their wives were coming to the day program. And I know that during that drop-off time, that was my time to see them. They were bringing their wife in. They weren't coming by to see me for any emotional support, but I know that when they did that, there was that vehicle that they were able to get the support that they needed. And I just find that really is a difference. Often women will be very clear, maybe aside from the physical health, aside from anything else involved, they'll just tell you, I really need some support. I'm having a really hard time with mom or dad. But the men will almost never come out and tell you that directly. It'll come out through the conversation, through another vehicle.
So the sources of stress, we only focused on the things that stood out as being, because we all know being a caregiver to anyone, even if you're a male or a female, is a very stressful duty. It's a very stressful situation. So we only focused on the things that stood out as being unique or special to men. And one of the things, especially this article, and if anybody wants a copy to read, I can be happy to provide copies. What it boils down to is it going back again to identity. And the women say they're more stressed. If you do interviews and measure stress in male and female caregivers, the women will say they're more stressed. The men will say they're less stressed. And what this article points out is because the caregiving tasks are not linked to their identity like it is for women who are sort of conditioned to be carers all their life. So caregiving is actually directly linked to their own identity. They feel more stressed as caregivers. And the males will say, we're not as stressed, but there's certain parts of caregiving that make them feel very stressed, and that's what we'll talk about. For them, the learning of new tasks, which are primarily domestic in the case of men who never did a lot of housework, is stressful. They find that stressful, that whole managing of it that the women have been doing. They feel extremely stressed by the level of dependence of the care receiver and the level of that person's cognitive loss. they also, many of them often start to lose their own social network because the socialization and the social network was often managed and linked more to the wife, or not so much the case of adult sons. And they have a terrible time managing family conflicts. Maybe they've not been directly involved in the family conflicts, and it's mostly been the wife that's managed the family conflict. We all have them, but they find that very difficult. So they identify, those are the main things they identify as their sources of stress. How they manage their stress is very, very interesting. And they adopt the care manager role as opposed to caregiver. And the care manager means they've taken it on as a job. That's their job. They're learning the task, and they're the care manager. And which for them minimizes their emotional burden. They're more apt to use physical activity to manage their stress. They suppress their emotions. That's certainly not news to any of us. They tend to minimize the impact of their caregiver role. So if you're a person doing a home care visit and you ask them, how is it going, they probably most likely will say, not too bad, it's okay, I'm managing, we're getting along. Whereas the woman might tend to express more of her stressors. They tend to use more alcohol and medications to manage their stress. And the interesting thing is they will use more physical restraints. And the thing, this is, again, going back to this article, like I said, this was a real eye-opener for us. In the article, there's a story of a man who was caring for his wife with Alzheimer's disease, a fairly advanced Alzheimer's disease, and he needed to mow his lawn. He couldn't leave her alone in the house. She's not safe in the house by herself. So he brought her outside and he put her in his truck and he tied her into the truck so he could keep his eye on her while he mowed the lawn. Now, when he told this to his support group, the females in the group were appalled at that. But for him, he was problem solving and he found a viable solution. He was able to do his lawn and keep his eye on his wife, who wasn't happy, by the way, of being tied up to the steering wheel and restrained in a truck. But nevertheless, in his mind, she was safe. And that was what his goal was. Another man in the same article, his wife got up many times during the night and she was going to the bathroom everywhere but where she should. So his solution was he tied her to him in bed so that she couldn't get up without him waking up. You're laughing. It is, there's a little bit of it that's kind of funny. And yet, how clever, I mean, in terms of problem solving, but in terms of safety, all of us know. Would we, pardon?
It shows.
It's kind of romantic.
But it shows sort of that practical case manager approach. You know, this is what I have to do. So not getting caught up in the emotional piece of it. You know, you could see how other people would say, oh, I upset my husband so much. He was so upset being tied to that steering wheel, and I can hardly forgive myself. But the men that came out in the study, they had these really practical solutions, and they didn't lose a lot of they didn't have a lot of emotional upset over some of the strategies they came up with.
No,
for better or worse.
This made sense. This made sense. And the other men in the group thought, that makes sense, you know. It's just,
the job done.
It allowed, I can
job
see
done,
her,
lawn mowed, she's safe, I don't need to worry about her, you know. So, I mean, but the thing that struck me there is, I don't know about you all, but as a practitioner with caregivers, I honestly would never think to ask the men in my group if they do stuff like that. It wouldn't have occurred to me. Like, do we even think, well, what do you do when you need to mow the lawn, sir? You know, who takes care of your wife? Like, it wouldn't occur to me this. So knowing that they may have more tendency to use physical restraints, another fellow in there talked about his wife needing a shower and her refusing to bathe, which is another common side effect. As we all know of dementia, they don't want to wash. So he just literally stripped her down physically with her fighting tooth and nail and dragged her into the shower with him and held on to her. You know, all of these things we all know are not safe, but they're being done. And sometimes we don't even think to ask the questions to figure out how he's getting his tasks done, because that was certainly an eye-opener to me. And I do sometimes bring the subject up in my groups now, especially when the men are there. What do you do? How are you getting your stuff done? You know, who's with your wife? Can you leave her alone? And how? Yeah, and because if you go in and see everything's all clean, who did it? Was them? How did they do it? That to me really stuck.
They don't know the You're trying to hold it back. They think you're learning them, and then they smell it.
Tasks are the traditional roles, but
How are you? What are you doing to get stuff done, knowing that she cannot be left alone in the house?
We embrace the okay? The fact is, again, we're saying
Exactly.
I know,
it's a bit the same idea.
Somebody said, "Not me."
Then you're going to be
Not maintenance. But if you're talking to a male caregiver,
Has someone dementia.
and he's got that role, he's still got all the maintenance duties, and now he suddenly has this whole new learning curve of how to do the domestic stuff, or at least to make sure they're getting done, or not. Is the cleaning even being done? You know. It's interesting because when you start to put that curve on it, that slant on it, that maybe our vision, which we all know is, I find our psychosocial intervention model, so to speak, is very feminist oriented because the majority of the caregivers we see are females. But like our study said, the number of men who are going to be or are caregivers is rising. More women have dementia and more people are staying home. Our government wants people to stay home longer, and there may be a different whole questionnaire that needs to be asked to the male caregivers, the older male caregivers, related to that, maintenance and so on. And so where was I? So the physical restraints part I thought was really interesting. Now, the last section we're going to talk about is what do the practitioners say? Because Jacques, our colleague Jacques, interviewed a lot of workers to say, how do you perceive male caregivers? What are they saying? They agreed. They find in their practice, older male caregivers want concrete services. The whole psychosocial, emotional support didn't count as high for them as really concrete things. They want them quickly. The practitioners already said that. And they observed that they seem to get more assistance from their children. And many of the practitioners interviewed had an overall impression that the older men were less capable, were less good at the task as caregivers. I don't know if you would or wouldn't agree with that. And the practitioners said that the clients seem to use fewer psychosocial support services. Agree, disagree? Comments, Bill?
I think it's true. I think they need help and they need it quickly. So I think as long as you've got them on the hook, you have to be able to offer something quickly. And I think with wait lists, I think in our climate right now, it may be more difficult to serve men. Certainly the evaluation team, people going in, if you want to create a lien with someone, you really do need to act quickly and give them good information in a timely way and be able to respond to them fast. So I'm afraid that this could be really challenging to serve our men, because often they do wait, I think, till it's a real crisis, until they ask for help, and you have to really seize that moment. You know, we've had referrals where I've gotten one where someone came in, he was disoriented in the snow, he was upset, caring for his wife, he kind of hit a crisis point, so we have to be able to access them then.
I don't know, whatever, think about it.
But my observations, the psychosocial support, it's funny, not for themselves, but they do respond to guidance around preparing their wife for long-term care, the psychosocial piece that is more geared for the client. They don't know how to approach the preparation, the mental preparation that comes with.
Yeah.
I see this at the hospital a lot too, because I do the guichet trajectoire work, and I notice when there's a son involved, if I get a pre-fin de soins active referral and there's a son involved, even just this past week I've spoken to one son at least twice about what the path could be for his mom, because you can see he's trying to plan, he's a case manager. So it looked like we were going one way first, but now his mother is unstable. So she's in the hospital. He wants to know, are we placing her, are we bringing her home? I'm trying to reassure him that we'll do the right thing at the right time, but we have to wait for stability. And that's, like as you say, he's really planning as an organizer. You know, that case management piece is coming into play there, for sure. I see that more, that kind of anticipatory thing. They need to know what the path will be. I think that there's more stress with the uncertainty of that.
Yep. So, needless to say, the practitioners reflected back to us in the interviews as well that the services have been developed to meet the needs of females. So they're searching as well. We met with a lot of community practitioners, which was interesting. Not so much on Montreal, but if you go off the island, it's interesting how many community organizations that have been developed to meet the needs of the home care clients. So they work in collaboration, very much so, with their local CLSC, CIUSSS. And that we find there's St. Hubert, there's one in Brossard and Longueuil, and that's just a few of the Montérégie. But the community support has been almost more developed in regions than it is on the island of Montreal.
I think it really is. They're considered pivotal partners.
Yeah.
You know, these organizations that are set up with Yen and the others, it's really incredible the work. The workers know them well. They refer out constantly for that kind of support. So it's nice to see that kind of partnership.
Yeah, it really was a great thing to see. And the practitioners are saying, when they do encounter men who are looking for certain kinds of support, there's very few available that we can offer, like in terms of a support group just for men. There's a group that's been developed in Longueuil, which we thought was interesting. And this woman has developed support services for male caregivers. And she said she realized the men weren't going to come to her. So she goes out into the community. She'll actually take a few men on an outing. She took them to the train museum. They went to the racetrack. And in that context, in the context of where guys go, they were able to start talking about their role as caregivers. When she went to their safe environment where they socialize, not expect them to come to a building like this and put them in a room and let's all talk. You know, and that was really interesting. And so the ideal thing would be able to offer something, you know, go where guys go to talk to each other. But, you know, in an ideal world, this is very available more in the community than we could actually offer. One time in the Caregiver Support Center, we tried to organize a cooking class for male caregivers. It was actually before I was working there, and I think it worked sort of. You know, the guys were learning how to cook a few dishes. And the men, and this is an observation I can agree with, the men who do come to support groups, they want to share information. They want to talk finances. They want to talk about care management and things like that. They're not so much wanting to talk about their feelings and of loss and all that. And that's not to say they don't have them. They do. It's inside. They just don't want to talk about them. And I always find that a delicate balance to maintain, even in the support groups that I run, to balance for the needs. Because I started asking myself, are the guys coming, getting their needs met? Because the women are going to talk about their depression, their loss, their sadness, that they're living widows, their things like that. And the men want to know, you know, what kind of financial reimbursement is available from the government for being a caregiver. You know, all valid questions. And I wondered, but the evidence to me that their needs were somehow being met is that they just kept coming back. And they come back and they come back and they do attend every week. Right now in the spousal support group, I have 4 men that attend every single week. Of a group of 10 to 12 people, that's a fairly good proportion. And that's men who have sought us out, or the people who come to our groups are all referred by you. Okay, so